After much talk, retail marijuana is likely on its way to Western Massachusetts. Amanda Rositano, the compliance director for the New England Treatment Access, joined me in the studio recently to discuss the retail marijuana license awarded to NETA's medical dispensary in Northampton by the Massachusetts Cannabis Control Commission.
I wouldn't say that it's been too stringent. I think that, the Cannabis Control Commission is really doing the best job that they can to try to get everything in order for us to open. I think that, our hope was to have been open by now. However, we understand that this is a new industry, this is a new endeavor, and the commission, wants to take their time. So, we wish that it would move along a little bit more quickly, but we're also understanding of the position that the commission is in right now.
And at this point, while the Cannabis Control Commission, the CCC, that's easier for all of us to say, did give this final approval, there are still a couple of steps to go. So do you have a sense of when you might be open for recreational sales?
We're hoping that it's within the next couple of weeks. We've been doing everything that we can to sort of push forward with the final loose ends that needed to be tied up. Some of those are on the CCC as well to kind of tie up on their end before that they can get us the certificate to commence operations, which we hope is going to be coming soon.
And people might hear New England Treatment Access and be hearing our conversation and think, well, you're already open in Northampton. What are they talking about? We're talking about the difference between recreational sales, which you're not yet finalized, finally permitted for, and medicinal, which you have been open for quite some time.
Right. Yeah. So we've been open in Northampton for medical marijuana for about 3 years now. So we will be, a co-located medical and adult use facility in Northampton. So the difference is that, our medical patients will still be our priority. They'll come in, they'll have separate lines, separate service stations. They can still expect the same experience as they've gotten.
All within the same facility.
All within the same facility. And then we'll also be allowing adults over 21 to come in and make a purchase.
Yeah. And I know that one of the things that's been the holdup at the CCC level has been this lack of a laboratory to say, okay, this is, this recreational product is safe for the public to use. Now, obviously, we said you have a medicinal side of your business already, and that marijuana goes through a similar but different laboratory process.
It's actually the exact same laboratory process.
But at the state level, they're saying it needs to be broken out. There needs to be a medicinal lab and there needs to be a recreational lab.
Fortunately, the two labs that we use currently to test medicinal are the same labs that have just been finally licensed by the commission to test on the recreational side. So it's all kind of coming together, and we'll be using the same labs essentially to test the same types of products under the same testing protocol.
I know that's one of the things that your Director of Government Relations, Norton Arbelez, asked the CCC to sort of waive because, as you say, the processes are the same. So that's no longer a factor with that new permitting at the laboratory level.
Yeah, I think that issue has been resolved in the sense that now the labs are licensed, so we can move forward in selling the products that we have tested under these labs.
So assuming that you do move forward to get the final check marks, is there going to be enough supply to meet the demand? There will only be 2 recreational stores in the entire state if licensing goes as expected in these next couple of weeks.
Well, I can tell you that NETA has been working very hard for quite some time to prepare to up its inventory and to really increase production in order to prepare for this. We feel confident that we're in a good position. We are also confident that the commission will continue to license entities, so that supply will continue to grow. So we'll see how it goes.
Can we talk about cost for a minute? The World Drug Report in 2017 looked at different states, different countries even, for the cost of a gram of marijuana, and Boston popped up as among the most expensive, about $11 a gram. Do you know what you'll charge at this point for marijuana?
So our prices will remain consistent with our medical prices. The only difference will really be the tax that will be imposed on the adult use side.
And so that totals to about 20%, if I'm recalling correctly.
Correct.
Yeah.
Yep, that's correct.
And so that same report that looked at this price of marijuana for places that had either fully legalized or partially legalized looked at the illegal market as well, and you're looking at about $2 a gram if you buy on the black market. So what's going to be the incentive for people here in Massachusetts to use a licensed legal facility?
Well, they can be assured that those products that they're getting are safe, that they've been tested by an independent laboratory. They can know exactly the cannabinoid content within their products, so really exactly what they're getting.
And explain to people the cannabinoid content, what exactly that means.
So cannabis has, a variety of different strains, and those strains may have different levels of, different compounds that make cannabis what it is. So THC versus CBD and the percentage of those things. So you come to a dispensary and you really have choice in regards to which products are going to be right for you. If you're purchasing on the black market, that choice is really limited if it exists at all.
And when you're talking about THC, that's the active agent that activates the high in the product, correct?
That's correct. And nowadays there's quite a demand for products that don't make you feel high or that psychoactive effect. Those CBD products that reduce inflammation and help with pain. A lot of our patients now are really moving towards those types of products that provide relief without a psychoactive effect. So that's another benefit to coming to a dispensary, is you'll have access to products that are not as likely to be found on the black market, such as topicals, lotions, capsules. There's just the variety will be much more broad if you're coming to a dispensary, especially at NETA, where we have over 160 different products.
One of the things that has come up in the last few years since recreational marijuana has been legalized is this concept of leveling the playing field. Because marijuana was illegal, there were minority groups and communities that were just disadvantaged because of this. And the CCC worked really hard, they say, to level that playing field in some way. But I think there are people who look at this and say, okay, the two companies that are first being licensed already are in the game. They have medicinal locations. So do you have an unfair advantage?
I think that the commission, has been working really hard to get some of these, what they call economic empowerment applicants, up and running. But the fact of the matter is, because we are established, we're more prepared. So I don't necessarily think that, we're given an advantage. I think we have an advantage because we've done this, we have the experience. So I think that the commission is really still putting a lot of focus on how they can really help those that have been disadvantaged by the war on drugs get into the market. And I think that a lot of the existing dispensaries are doing a lot of work to help those players in the market as well.
One other thing that we've heard from people when we had a town hall here was the concern about public safety, because there aren't yet regulations for how high is too high and driving while high, things like that. Do you have any safety measures in place if someone comes into the business for people that you might not sell to recreationally?
Yeah, I would say, similar to if you're operating a bar and somebody comes in and they're visibly, intoxicated, or, you for some reason think that, by serving them, you're going to, create any kind of harm, we have the right to refuse service if that's necessary. So we would do that if in that event. But, we spend a lot of time educating our patients, and we'll do the same with our adult use consumers as it relates to, what we call low and slow, dosing very, very low so you understand your own tolerance, safe storage, safe storing products out of reach, and really in a way that protects, people who shouldn't have to get their hands on it.